Good afternoon, good evening, good morning, wherever you are in the world or whenever you are watching this presentation. My name is Obi Oninania, and I'm a graduating junior at Johns Hopkins University. I am mentored by Dr. McGuire from the JHU Coach Lab and sponsored by the Woodrow Wilson Fellowship. My presentation is on the construction of the motivation assessment for tic suppression. Throughout the study and the presentation, we will refer to this assessment as the MATS. The MATS is an assessment that measures motivation behind tic suppression. To begin, we will discuss the main disorder that produces tics, Tourette syndrome. Tourette syndrome is a neuropsychiatric condition in which an individual produces movements and sounds that come in a range of frequencies, intensities, and severities. There are few treatments for tics, but the patient outcome is varied. And while this condition is characterized by uncontrolled urges, the inhibition or suppression of them can be influenced by different factors. These can be environmental, weather conditions, social situations, family reactions, and more. So even if the urge to produce tics remain constant, the actual expression of them is affected by these motivators, which can result in positive or negative consequences. After the methods outlined below, the MATS was created to quantify this relationship into a Likert scale that groups these motivators into 4 factors with the hopes of them serving as a predictor and guide for more individualized and improved outcomes in behavioral therapy. The concept of this assessment came about while I was conducting a field study over the summer with the Johns Hopkins University Coach Lab. After receiving the necessary clearance, I was tasked to watch past videos of patients who came in for behavioral therapy. They began with a screening, a baseline visit, then global improvement was rated after 10 weeks of treatment. During each of these visits, the tics present, their frequency, intensity, complexity, and interference were rated on the Yale Global Tic Severity Scale. This is referred to as the YDTSS, and it assesses tic severity and just tic interference in everyday life, the settings which they occur, and that brought out many discussions and questions to me. For example, when a parent mentions that their child has high tic frequency, the child may disagree and make a statement such as, "Only at home, I don't tic that much at school," or other statements that just led me to realize that situational and environmental factors affecting motivation may be a cause for due study. After that, I did comprehensive literature review and summarized that our dopamine reward pathways influence learning and behavior for even actions that we are unable to control. After this, although this is much more difficult for those with high urges, there are certain motivators that seem to more heavily affect expression due to the decision between a larger later reward, which can be something such as doing well in school or improved academic progress, or a smaller sooner reward, which can come in the relieving an urge that comes with a tic. The assessment was constructed, organized, and reviewed several times. It was then converted into an online survey and presented alongside 14 additional assessments for tests on validity and reliability. The survey is currently being sent out on national Tourette listservs, and participants must have tics, be over 18 years of age, speak English, and then they are given a $25 gift card for their participation. The data collection process is still underway, and the MATS and all its 71 prompts can be viewed in the analysis section of this presentation. With the small sample size and the data collected so far, we do see some of the predicted patterns. For internal factors, participants were most able to suppress a tic when they were feeling confident or feeling relaxed. This had an average rating of 2.9 on the 1 to 4 scale, with the question being, when are you most able to suppress a tic? The lowest was when I'm feeling overwhelmed, with an average rating of 1.36. For external factors, most able was an average of 3 was when tics affect workplace or classroom performance, closely followed by professional, academic, and social factors. As you can see on the graph, prompts H through K, which are the family-related factors, scored the lowest. For situational factors, participants were most able to suppress when completing an activity that requires a high level of concentration, such as driving. And driving was also the second highest rated for most able to suppress a tic. Then least able was when they are in a place of intense sensory stimuli, which can be when it's noisy, bright, cold, or hot. For motivational value, participants were least motivated to suppress for health and well-being with an average rating of 3, closely followed by to avoid performing poorly in job and academic work, and then least motivated to suppress tics for loved ones. This correlates again with the earlier hypotheses that there's more acceptance and understanding from loved ones, which may limit negative consequences, hence motivation to suppress tics at home. Due to the fact that data is still being collected and analyzed, there are no conclusions regarding the actual validity of the survey and whether it actually fulfilled the goal of serving as a predictor for tic severity. However, we do predict that motivation for individuals may be inferred if certain patterns are observed within their responses from separate assessments. For example, someone with high urge on the premonitory urge for tic scale, yet low tic severity, yet low tic frequency and severity on the adult tic questionnaire, they may have high motivation. With a larger sample size and more statistical analysis, we can make conclusions about not just what motivates individuals, but whether the survey can actually be used for treatment. Thank you so much for listening. Please contact me or the JHU coach team with any questions.